Hello, everyone, and welcome to this interview by Healthcare IT Today. I'm John Lynn, the founder and chief editor of Healthcare IT Today, and today we're sitting down with Sheila Loy. She's the director of healthcare segment strategies at HID Global. Welcome, Sheila.
Thank you. Thank you for having me, John.
Yeah, I'm excited to learn more about you guys. I've seen a lot of your stuff in the past, but obviously we're in a different world with the coronavirus. So tell us, briefly about yourself and HID Global.
Sure. Sure. I'm the director of vertical segment strategies, as you mentioned. The vertical that's in focus for us for 2020 is healthcare. I've been with HID Global for 15 years, and I've spent the past decade or so concentrating on the healthcare industry. It's changed a lot. It's changed a lot in the last 90 days. HID Global manages the trusted identities of people, places, and things. We've been in business for over 30 years. We operate in over 100 countries, and it is the unique opportunity for our organization to really manage identities from both physical spaces, where we're a little more well-known, and to digital spaces.
No, that's great. And I think you guys do have such a portfolio of options and solutions for healthcare. So it's interesting that you're putting a focus there. And I think one thing that's really been interesting that's happened since COVID-19 is all these issues with asset tracking and asset management, and things like stolen masks are now becoming this like gold commodity that everyone wants to have, right? The PPE, or even tracking ventilators. Where are the ventilators? How are they being used? And all things like that. So what are the types of solutions that HID Global offers around asset tracking and even security of those assets?
It's a great question, and it's really, really relevant right now. In fact, back in February, I talking to an end user. He's like, "Can you believe we're having to put masks behind secure doors and secure areas because people were taking those?" So that's a reality. HID can track assets. So we can track the respirators or infusion pumps. We can track wheelchairs, some of those traditional assets. And those are important because time is money. But we can also track people and patients. And I think that's one of the places that we're finding with kind of an Internet of Things approach, we're finding a lot of traction, especially right now with the pandemic. So our solution leverages a state-of-the-art platform with Bluetooth Low Energy, or BLE. So it's a real-time collection of data. And data is time, data is money. So one of the more important solutions that we've been able to help so many healthcare organizations is with contact tracing and with surge. So we've actually put this solution, which is a very large platform that supports a lot of application, but we were very nimble in some rapid innovation development and put this together in a kit. So we're able to very simply get these out to hospital locations, even pop-up locations, and they can very simply and easily install it. So what it does is track the patient and staff interaction. So then if someone is diagnosed with a test and has been shown that they have tested positively, you can go into a quick mitigation mode and inform people that they have been exposed, and so that their actions, of course, can change. Their locations can change, their gathering points can change. So it can also track the health of equipment, making sure that maybe refrigeration of expensive drugs, for example, you can track the health of that, and you can get to it before it becomes a crisis and you have to move all those drugs to a provision somewhere else. So it's really it's a solution that has a very, very cost-effective price tag, and it is open architecture, so many, many other applications could be built out besides the traditional.
Yeah, well, and I think Google and Apple kind of introduced us to the contact tracing, although I love that you're doing it in a more controlled environment, because
Right.
many have said that, it's great that Google and Apple are working on it, but if we only have 25% opt-in, it's hard to get really great results. Whereas in
Right.
a hospital, we know they all have a badge because you
Yeah.
don't go to a hospital without, and are able to do it within an enclosed environment where you could track it much better.
Yep,
So
you can set
that's
up
really
hot
interesting.
zones. Yep, absolutely. And it's really at the setup discretion of the hospital provider themselves. With very little direction, they can really make it be what they need it to be in their particular, hotspot circumstances.
Yeah. The refrigeration example is really interesting too, especially since they're not allowing any of these elective procedures. So I
Right.
imagine the drug expiration has become an exponential problem for many of these organizations who would normally use, a certain amount of a certain drug, and now they're just not doing those procedures at all. So
Exactly.
that's really interesting as well.
Yep, yep. Try. It comes down to data, right? And I know
Yeah.
data, big data, but really when you can digitally track people, places, things, the health of things like equipment, expensive devices, then all of a sudden your return on investment is pretty slick.
Yeah. So you talked about some of the trends, obviously COVID-19 related. Are there other trends you're seeing in really secure identity management? And really, how does that translate to benefits for the healthcare facility? Because right now, if it doesn't benefit the healthcare facility, they're not even paying attention, right?
Right.
Like they
They're
have enough
not.
to do with.
Eyes on the front line right now, and we expect that, and we are really trying to support that type of attention with our end users. We might in some cases be in the middle of a project, but we understand all hands on deck with what you're dealing with, and we'll try to be the best trusted advisor and strategist with you as we can. um, of course, the trend, if you asked me this 90 days ago, the trends might have been a little bit different than they are today because this cloud is hanging over all of us. But I think I'm not even going to call them normal times, but in non-pandemic times, I think that the biggest trends that we're seeing are frictionless authentication and simplicity. Right now, the biggest problems that so many of our end users have is they've invested in Band-Aid applications. And I actually had one gentleman call it Tinker Toys. And it's just gotten to the place where it's really hard. I always give them credit because I thought it was a very accurate example, but it's getting very hard to support myriad different non-connected applications. So we'll start with like simplicity and automation. Shocking amount of healthcare organizations today still have very manual onboarding processes. So people are standing in line on day one, people are filling out forms, getting their picture taken, and all of this. It's a very frustrating experience, not only for the healthcare organization, but for these new employees that you're trying to impress and bring into your fold, right? So there are several different ways organizations can approach that with a more smart onboarding process that takes a lot of the manual effort out of it. When you take manual effort out, you reduce human error. Things can be queued up. We can track those identities. We can attach a role to them, their access privileges to them, and we can launch them and get them up and running so everyone has a real positive experience. So workflow automation, really a hot topic. What I mean by frictionless simplicity is really around the fact of authentication, proving you are who you say you are so you can get into a door. Most people are pretty familiar with HID's portfolio when it comes to that. An ID badge, a reader, it's got a visual identity, and then you use it to get into the door. But you really can extend the value of that badge. You can upgrade to encrypted technology, which is, I think, a hot button. And when you move to encrypted type of technology, you also extend your user experience from just using that ID badge to using a mobile device like a smartwatch or a mobile phone. So frictionless simplicity, make it just be part of what I do on an everyday basis with the tools I use on an everyday basis. And then lastly, I think the healthcare organizations should think of digital and physical, kind of how we started our conversation, as an identity management continuum. Much like their focus on continuum of patient care, turn and look inside the organization and really consider digital and physical, one particular continuum, and keep the focus.
Yeah, well, it's interesting you said the continuum, because when I was researching for this interview, I saw you guys reference this smart healthcare continuum, which, I'm not sure how exactly you define it. I'd love to hear your perspectives on that. I mean, to me, it sounds like, where are you at in the process of making your identity management solutions and your other solutions that we've talked about, making them smart, making them connected, making them more powerful. And what's interesting is we've learned in this COVID-19 process that if where you were on that continuum determines what you're able to do. And if you're early on in it and you don't have the tech solutions, forget about contact tracing, right? You're not going to be able to do it. Whereas if you're more advanced, you can do it. So is that what you guys mean by this whole smart healthcare continuum?
Yes and no. A great example when applied to today's world, right? And a lot of the solutions that you've maybe invested in already, you could repurpose, right? Maybe you didn't think about contact tracing, but if you have some of that, you could repurpose, right? We think there are 4 pillars to our continuum, and the first one is really important in that whatever you're investing in or the solutions in your portfolio should just bake safety and compliance right on in. We think that you shouldn't have to do something separate. You shouldn't have to go outside your workflow just to make sure you're being in compliance. This is great for obviously HIPAA, but OSHA, GDPR, depending on where you are in the world, the types of steps that can be built into the automation and the digital transformation take that decision away from the staff member. The second is providing patient-centered care and this is so important. I was just reading this morning, that starts with positively identifying your patient. So many times that patient record gets launched, the wrong person with the wrong record in the EMR system, for example. Or this morning I was reading about we're getting better at that by using a biometric and making sure Sheila Loy is who Sheila Loy says she is. But then now there's a little difficulty in transferring that data. If I'm going to share the data with a partner healthcare organization, verifying it yet again. So it's ever changing. But making sure that your patient-centered care starts with positively identifying the patient, making sure that the physicians are authenticated and that the staff is continuously authenticating, so that you've got the opportunity to employ frictionless ways to prove themselves, and they should have access to this data. They should have access to this shared PC or this shared cart, for example. And then I think very important to the digital transformation is investing in operations that have open architecture, things that will provide you integration capabilities, automated efficiencies, and choices, because there is no one size fits all in healthcare, in any industry, but especially in healthcare. If you think you're going to take a cookie cutter approach, it's just never going to fly. So make sure that there are choices in the investments that you have so you can be flexible with your staff as well as with your patients. And then lastly, right in line with that, offering positive experiences. There is not a solution in the world that has been adopted successfully if the experience has been cumbersome, time-consuming, confusing. So make sure you offer positive experiences in the deployment, and making sure that there's good supported training. For example, Make sure that it's simple if you're going to roll out an electronic prescribing, online. Push the button here. Some electronic. I've got different things on my screen here, but I think it was my fault. Prescribing prescriptions online, your narcotic prescriptions online. Make sure it's simple. Make sure the workflow is easy and understandable, and everybody feels supported.
Yeah, I mean, I think people have been through troublesome implementations. It's interesting you bring up EPCS, right? Electronic
Right.
prescribing of controlled substances. You guys do a lot of work in that area. So, and I think it will become even more important in this kind of touchless environment. Like, why am I handing you a piece of paper, which you're going to take and spread around your house and then go take to a pharmacist who's going to spread it? Like, that's probably not going to work in this new world. So, what are the key considerations when implementing it?
Where paper doesn't work is with telehealth sessions. And so that you have to employ an online a digital prescribing that's, of course, DEA compliant with your identity proofing and your FIPS 140-2 certified credential. 22 states at last count have mandated that electronic prescribing for controlled substances, or EPCS, narcotic drugs, that they employ that within their state healthcare organizations. It provides a variety of benefits. One, of course, is touchless. I can now write a prescription following the proper procedures from a conference, from my home, from 4 different clinics. I don't have to get up, search around for that common triplicate paper pad with watermark on it. And that's not a good experience for the physician, but it's even a worse experience for the patient or the patient's family, because now I have a piece of paper, and those drugs are what some people call the good drugs or the pain drugs, right? And if I am in pain, this was my own firsthand experience, and I have pneumonia and I need a narcotic, now I take my paper and I have to drive to the pharmacy and I have to hand it to them and I have to sit and wait, and now I'm coughing, and it's a terrible experience all the way around, versus the penicillin, amoxicillin type of prescription where everyone is accustomed to showing up or driving through the pharmacy and it's right there for you. So it really just extends that positive experience to the physician as well as to the patient. And when you've got patient-centered care as your focus, that's definitely a solution that you should invest in. And not a lot of people know that HID has a wide variety of choices when it comes to putting together a turnkey solution. It's really important to us and to many of the compliance hoops that we work with, that we've got the opportunity to identity proof and use that same source to issue the credential. Your credential choices these days are mobile phone is the most, but there are other choices. You can do it with your ID badge. You can do it with a token or something, but your phone is something you're always going to have with you, right? And mobile devices aren't going to go away from the healthcare setting. I think it's funny that 5-6 years ago, some of the conferences were, should we allow mobile phones? And like, well, good luck with that, right?
You don't have a choice.
But I think it's important, if you are looking for an EPCS solution, that you really do understand who owns what. And make sure that you are in compliance with every piece that you're standing up to allow that frictionless experience for your physicians and your patients.
That's great. So, let's wrap this up with, because, hopefully, and I'm an optimist by nature, so we're going to get through this, right? We're going to have some, either, some treatments, some other, some things to deal with the crisis, and
Right.
life will go back to a new normal, as everyone's calling it, right? But, when that comes, what are the core solutions that you think healthcare organizations should really be looking at to make sure that they're prepared for the next crisis or the next, the next challenge that healthcare is bound to face?
Right. It's a really good question, and I think we're all wondering when that is going to be, right? When will
Yeah.
we take our eyes off of this pandemic that we're all dealing with? But that day will come. I agree with you completely, John. I think I have two perspectives to that answer. The first is really about solutions in general that will be important to hospitals as we recover from this. I think there will be an evaluation. What do we have? What do we
Yeah.
need? That kind of thing. Um, I think visitor management, interestingly, is really something that some organizations have invested in and some really steered clear from because we want to be hospitable, we're an open, welcoming environment. I think everyone's going to have a different perspective on visitor management because there are visitor management solutions out there today that can literally track your background, make sure we know you're in the facility in case we have to find you, give you information. So from a safety perspective and a management perspective, I think we might see a tilt in the trend towards visitor management or systems like we started off with, real-time systems that literally do track people, and people aren't going to mind being tracked or knowing that they can quickly find who they need to find their way through an organization with a wayfinding type of solution. So I think there'll be some priority placed in long vision, the long view type of solutions that not only will help their organization in new normal mode, but will also be able to really be applied in a situation where there might be a crisis. The second slant to the answer might be a little surprising, but I think that the digital transformation in healthcare will include cloud. Subscriptions, mobile applications. I know there are many healthcare organizations out there today that are still pretty firmly believing in on-prem for security, and privacy data is very important. We don't want to take our eyes off of that. But I think that cloud is going to be the way of the future. I think we have to get our heads wrapped around that. And I think it goes against the grain of traditional healthcare providers, but I think 5 years ago they weren't going to let mobile phones in their organizations either, right? So I think this too will find a place when it's understood, when there's a high level of security and comfort. The IT teams will be able to be prepped, trained. I think they should look for the right types of skill sets in the talent that they should hire for the next 5 to 10 years. And this direction will really alleviate the need for that tinker toy type of myriad applications within your stack that need to be watched, monitored, updated. And I think all in all, it will be a very healthy thing for the industry to move in that direction. I think they'll find benefit there.
No, I agree. And, I've often said about cloud, could you imagine a new startup company that wasn't cloud, right? I mean, it would be embarrassing to think that they were going to do an on-prem solution. So, I agree totally on the cloud. It's very interesting, your patient tracking idea and visitor tracking. That has been something that has been a challenge. And, my colleague, Colin Hung, once described it. He said, what happened after 9/11? The waiting areas in airports used to be able to greet your person as they came off the plane.
Right.
But now, at post 9/11, you had to redesign those areas with the idea of like, hey, this is just a waiting area. It is not a greeting area that like it would before. And he said, we're going to do the same in healthcare, I think, when it comes to visitor tracking, where we were kind of, we want the visitor in the room, and that certainly helps the, health of the patient. There's going to be a balance that's going to be interesting, but we're going to have a full redesign of what does a visitor mean and when is it allowed, I think. And I think that's what you're getting to.
I agree. And regarding repurposing, a lot of people, especially children's hospitals, really have or need or are looking at pretty sophisticated visitor management systems that do background checks. but it also
Mhm.
controls, right? So one of the repurposing things we're doing today is you get one visitor. That's it the entire time. You are, even unfortunately, even the really happy times when people are having babies, they get one, one person to come in, and it's the only thing that's going to help you as an organization manage that is a visitor management system that can say you're here, you are allowed in this space, and now you're not here, right? So again, it provides you the data you need to make the best decisions you can for your organization.
That's crazy to think about. I think when my first was born, my boss was there, my wife's cousin, her boyfriend. We had like a whole crowd, which is crazy to think about it too. But
I know it.
yeah,
I know it's
the
kind of
world has
sad
changed.
actually, but it is what it is today, and everyone's just trying to be smart and safe.
Yeah, that's some great insights. So let people know, where can they learn more about HID Global?
Sure, I would love to. You can find out the most regarding our full portfolio from going to hidglobal.com/healthcare.
Awesome. Thanks so much. We appreciate you having you here. And thanks everyone that's been watching this interview. We've been here with Sheila Loy. She's the Director of Healthcare Segment Strategies at HID Global. And if you want to find more great health IT content like this, check it out at healthcareittoday.com. Thanks, Sheila.
You bet. Thanks so much.